PowerForm Module 3. The next section we will explore is the medication list. This is where you will add home medications. From the medication list screen, click on Document Medication by History. Note the External Prescription History drop-down at the top of the screen. Upon selecting Import or View, a pop-up consent screen will appear. The paperwork granting consent signed upon a patient's arrival to the hospital is considered a valid consent for external prescription history. The patient's prescription history will display if the patient's pharmacy is a participant in the SureScripts database. After review of the external prescription history, medications listed can then be imported as appropriate. The patient pharmacy icon is also located at the top of the screen. Documentation of the patient's preferred pharmacy is important for the e-prescribing process used by our providers on discharge. Click on the icon to open the preferred pharmacy screen. If you will not be selecting a pharmacy, check the box next to No Preferred Pharmacy and select the reason from the drop-down. If the patient provides you with a pharmacy name and location, use the Search tab to find the appropriate pharmacy. Highlight, right-click, and Add to Patient Preferred. Now let's click on the Patient Preferred tab. This is where you will make modifications to preferred pharmacy documentation. Right-click and select Remove if a listed pharmacy is no longer appropriate for the patient. If more than one pharmacy is listed, a pharmacy can be selected as the default pharmacy by right-clicking and selecting Default. This action will move that pharmacy to the top of the list. Click OK to close the screen. Notice the Reconciliation Status box in the upper right corner of the screen. Documentation of the home medications or med history is the responsibility of the admitting nurse. Admission and discharge medication reconciliation is done by the provider. The status box provides you with visible verification of whether these tasks have been completed. The exclamation point signifies an incomplete status. The green check mark designates completion. Please keep in mind that the provider will be unable to complete the reconciliation process without the completion of the med history first. If your patient states they take no medications, you can simply check the box next to No Known Home Medications. If the patient is unable to provide you with their medication information upon admission, select Unable to Obtain Information. Click on Document History at the bottom right of the screen to complete the process. As stated earlier, when working with a control screen, always start with existing documentation within the screen and verify the accuracy of the information with the patient. If you find that you need to make a correction on the existing list, you can right-click on the medication and either complete or modify that medication. Let's complete the antibiotic displayed in the list. Right-click on ampicillin and select Complete. Notice a white line will now appear through the completed med. Once the med history process is finished and you sign off by clicking the Document History button, the ampicillin will drop off the patient's list. Please note, always use the Complete action rather than the Cancel action on medication the patient is no longer taking. As you review the medication listed, you may need to make modifications. Remember, a complete med history should include the drug name, dose, route, frequency, last dose date and time, information source, and compliance status. Right-click on the medication and select Modify. Modifications to dose, route, and frequency can be made from the Details tab. Modifications to compliance status, information source, and last dose date and time can be made from the Compliance tab. If upon review medication details remain as previously documented, compliance and last dose date and time should still be updated. Right-click on the medication and select Add Modify Compliance. This takes you directly to the Compliance tab. Documentation of compliance for multiple medications can be done simultaneously. Left-click and drag your cursor through the meds. Then right-click and select Add Modify Compliance. This functionality can only be used for medications having the same compliance status, information source, and last dose date and time. Once you verify the accuracy of existing home medications, additional medications can be added by clicking on the blue plus sign. Search using the alphabetized folders or the search box located at the top of the screen. If using the search box, make sure your filter is set to Contains. This will optimize your search capabilities. Using the folders, let's add atorvastatin 20 milligrams daily. Click on the appropriate medication and dose, then select the corresponding sentence. Note that the tablet quantities included in the order sentences are not pertinent to obtaining a history, but are used for ordering prescriptions. Click OK. Continue to search and add medications to complete the patient's medication list, then click Done to close the search screen. Remember, documenting compliance, information source, and last dose date and time is required for each medication on the list. Once you've completed your medication history, click Document History to sign. Now we will move down to the next section in the intake form, which is the Problem List Diagnosis section. Here the screen is divided into upper and lower controls. As a nurse, you will only document in the problem control at the bottom of the screen, since diagnosing is not within a nurse's scope of practice. To start, make sure the display is set to All. This will ensure you see all problems, including those that are active, resolved, or canceled, so that the list remains accurate and concise, without duplicates. Always start with existing documentation within the screen and verify the accuracy of the information with the patient. Make sure the columns within the control include at least the condition name, name of problem, life cycle status, date and time of last review, date and time of last update, and name of nurse performing last update. To add or make any adjustments in column display, right-click in the column header line and select Properties. Highlight and add any appropriate column to your Show Columns display on the right. Organize the order of column display by highlighting the column name and then moving it up or down in the list. Life cycle status should display in the column adjacent to Name of Problem. Click OK when done. As you review each problem listed, pay close attention to the life cycle status column. Life cycle status can be listed as active, resolved, or canceled. An active problem would be one where the patient continues to require ongoing treatment or medication. This would include the reason for this hospitalization plus any additional condition that the provider should be made aware of. For example, a patient with diabetes being admitted for a hip fracture should have diabetes included in their problem list as an active problem. A resolved problem would be one where the patient is no longer receiving treatment for that condition. If the patient had pneumonia last year, that problem should be listed as resolved. The canceled status is used for duplicate problems or errors found in the list. If you need to modify a problem on the list, right-click on the problem and use the drop-down to update the status. Remove any duplicates by right-clicking on the problem and selecting Cancel from the Status drop-down. You will then need to select Error from the Cancel Reason field. If you note any multi-drug resistant organisms, or MDROs, on the list, please do not resolve or cancel these. Our infection prevention team has a standing process to resolve MDROs. Once you have updated the existing problems on the list, you may need to add additional problems. To do so, click on the Add button in the Problem Control screen. Use the search screen or go into the appropriate Cerner SNOMED Common Problem folder. Your patient has a history of atrial flutter 2 years ago. Let's search for atrial flutter using the folders at the bottom of the control. Click to open the Common Problems folder, then click to open the Cardiovascular folder, and then double-click to add atrial flutter into the problem control at the top. Use the Status drop-down to select Resolved. If you have additional problems to add, click the OK and Add New button. When you are done, click OK to close the screen. As with the other controls, your final step in the process is to click the Mark All as Reviewed button at the top of the screen. This concludes Module 3.